Okay, so the first test we're going to do is taking a look at what's happening with your mouth and jaw. So for a moment, I want you to pay attention to where your tongue wants to naturally rest in your mouth. If your tongue wants to push forward, whether that's against the top or bottom teeth, that often goes along with some tension in these muscles here. Where we want the tongue to rest naturally is the top of the roof of the mouth, just a little bit behind the teeth. And that usually then can produce less of that tension in our jaw muscles. Now, why does this matter? Because we have connections between our jaw and our pelvic floor. So we have three diaphragms in our body. We have the glottis, so at the throat, that's what closes off your throat up here. We have our diaphragm here, just under our rib cage. And then we have our pelvic floor, which is our third diaphragm. And all these areas control pressure within our body. So if one area is impacted, it can impact the other areas and cause this difficulty with managing this pressure inside our body. There are also fascial connections and nerve connections between up here and down to the pelvic floor. When somebody has tension in their jaw, they will typically have tension in the pelvic floor. So it's one connection that we have found to be very common. So if you have jaw tension, if you clench your teeth, you know you have some TMJ issues, there's a good chance you might have some pelvic floor tension that you weren't aware of.